Hi, long time no see. We've been very busy. Don't quite know when we talked to you last, but I think when we did, we were saying that we'd been to the very first public meeting of the integrated care system, which is the new way of running and funding a mix of both the NHS services and care services for the whole of most of Suffolk and a bit of Essex. So it's yet another reorganisation. It's about 15 months in, and I've been going to these meetings, and I've been sort of banging the table a bit on the basis that here we are on the Felixstowe Peninsula. We're all very aware of the amount of housing that is being built. Those houses are being occupied, and those occupants, needless to say, are looking for appropriate GP coverage. So, would you believe, on the 13th of September at Walton Community Hall, we had a Felixstowe MDT steering group meeting, and I believe MDT is multidiscipline task group perhaps, but whatever it is, that's what it was. And it was hosted really by the Ipswich and East Suffolk Alliance, which is a level forget about that, it's just a reorganised system, okay? So they introduced what they termed and called current and future health, care and well-being needs and assets of Felixstowe and surrounding communities. Now, what we hoped when we had a meeting of all the PPGs here in Felixstowe way back in December, January, was that they would come and tell us exactly what might be happening with our surgeries, because though they disputed it originally, our surgeries are oversubscribed. I've got it here. It does say which of those are most oversubscribed, but it's a whole stack of stuff, so we'll come back to that later. But there is a specific amount of floor space prescribed per 1,000 people, and I'll come back later with what it's going to be. So, the outcome of this meeting, held in Walton Community Hall by not that many folk actually, sort of folks within the community, and as the chairman of one of the PPGs said, hardly reflective of the community of Felixstowe. But the end result, and that's as far as it seemed to go, was as things stand, the Ipswich and Suffolk Alliance group are meeting with our surgeries, the 3 surviving surgeries, because we lost Walton surgery, as you are well aware, and they are also meeting with East Suffolk District Council to ensure what actually is happening from a point of view of the build out that is going to bring another 10,000 people to live on the peninsula. So there has been progress. It's taken over a year to push the rock up the hill. We'll keep you updated as and when things go, and hopefully Bernard might be able to put a few clips out of the document for your perusal and enjoyment. Cheers for now, see you soon.